having the ability to do that at the bedside using ultrasound, it's not just a safety factor, but it's the ability to actually getting the procedure done. Hi, my name's Tom Cook, and I work in South Carolina with a large hospital system, Prisma Health. And I also am on the teaching faculty for the University of South Carolina. And for the last 21 years, I've been the residency program director. So I train all the residents at our hospital in emergency medicine. And over 200 of them are now graduates since I've been in my tenure, and they practice all over the United States. I practice in an area of the country where we have a lot of challenging patients, whether it's their body habitus, their pre-existing illnesses, previous surgical procedures, etc. And without a doubt, ultrasound has become really the second most important procedure that we do as emergency physicians. I mean, I would still say number one is airway. You know, you have to be able to do that. But getting vascular access, particularly peripheral vascular access, is important. Well, you can imagine these patients, it's tough. They just don't have vascular access. And so having the ability to do that at the bedside using ultrasound, it's not just a safety factor, but it's the ability to actually get intravenous access. It's getting the procedure done. I get emails, phone calls, texts, you name it, smoke signals from people all the time. I want to buy a machine, what do I want to get? And I try and be, you know, I don't know if the word's fair, but I try and tell them the pros and cons of all the different systems. I've worked with 4 or 5 different systems. But when I get to the Clarius, my usual commentary is what you're going to like about this is you're going to get really great image quality. You're going to like the fact that you don't have a cord coming out of it. It doesn't seem like something that may bother you on the front end, but you'll like it a lot more when you put it in your lab coat, and you don't have to have a goopy cord that's got crud all over it and you're trying to wind it up and whatever. And you'll also like the fact that the thing holds a charge long enough that you're probably going to charge it once a week or once every 4 or 5 days, and it's very, very easy to do because you're going to drop it in the cradle and you'll come back in 30 minutes and it'll be ready to go. So those are the things I always point out about the system, and more often than not, I see people lean more towards Clarius based on the different things I describe about it.